women in pain or young girls in pain are not taken seriously. It's dismissed as, okay, it's part of being a woman. Don't be a baby. Once you have children, it'll go away.
Hi, I'm Dr. Dhanvanti, and you are watching Anatomy of Bias. Dr. Abhishek, I wanted to ask you, when did you first see the patient that you're going to talk to us about today, and what did they come to you for treatment for?
So this patient was actually about to undergo an IVF procedure, and she was referred to me for a hysteroscopy to remove a suspected polyp from the uterine cavity.
Dr. Abhishek, what is a polyp in the uterine cavity?
Polyp is a small growth of the endometrium that can cause irritation and can also cause difficulties in conception. Now, this patient also had very severe symptoms involving the bowel. So she would suffer from constipation, painful passage of feces, and she had difficulty passing gas as well. So this would result in a cyclical bloating pattern of the abdomen, where these patients, during the onset of their period, they may look like they're actually harboring a 5-month pregnancy. The abdomen swells to that size because of the trapping of the gas.
So, Dr. Abhishek, this lady has her primary complaints to the OBGYN, that's the obstetrician and gynecologist, is the inability to conceive spontaneously, which is why it was diverting their attention to the fact that looking for possible causes of infertility.
Yeah, but I think the problem is a little more with a patient presented with a whole bunch of symptoms, and the focus was only paid attention to her ability to reproduce. The other symptoms were taken rather arbitrarily. When you're treating an endometriosis patient, you have to treat the patient as a whole and not just as a symptom, which is when you look at a lot of the guidelines that are prevalent even in Western medicine, from the American College of ONG or the European guidelines or even the Indian guidelines, there is an inertia to treat endometriosis related pain. So there is this, really delay of treatment and delay in diagnosis for patients who are presenting with pain. And for that matter, patients with endometriosis, 90% of them will present with pain, while only maybe 20 to 30% present with fertility or subfertility issues. So it's more important to view this patient holistically and treat it. In her case, of course, she was presenting with a very dangerous symptom of constipation followed by loose motions. So that is telling you that there is something in the bowel and you need to go and look at that.
Is this a common occurrence in your practice where you find the patient has to deal with societal bias from medical professionals who are simply unaware or ignorant of the fact of the progress of the disease?
Absolutely. Yeah, there is, it's a very common disease, first of all. There's a statistic that says it affects 1 out of every 10 patients assigned female at birth. And the incidence is as much as diabetes. I always jokingly say this, but there's a large element of truth to it. But if this disease affected men as much, there would have been a lot more, research dollars thrown behind it and a lot more attention paid to it. Unfortunately, only till it started being associated a lot with infertility did it start getting the attention. But it's a little untoward attention because the whole conversation about endometriosis gets rerouted towards fertility rather than debilitation and loss of quality of life, which is caused by pain related symptoms. And patients and their parents would always say that, oh, this has happened to us as well. And there is a lot of gaslighting, whether it's familial, societal, or medical, that, women in pain or young girls in pain are not taken seriously. It's dismissed as, okay, it's part of being a woman. Don't be a baby. Once you have children, it'll go away. There's a lot of these myths that are perpetuated through all strata of society that is a big hindrance to this.